I'm with Dr. Kimberly Kaphingst, a professor and associate chair in the Department of Communication at the University of Utah. She serves as the co-leader for Cancer Control and Population Sciences Program and research director of the Genetic Counseling Shared Resource. Dr. Kaphingst, can you tell me what made you fall in love with public health?
Yes. So I decided I was in the middle of a molecular and cellular biology graduate program and realized I did not want to spend my life at the bench, but I loved science and I loved the idea of communicating about health with the public. And so I found public health and was able to combine all of my interests. So genetics, cancer, communication, and have worked in that area ever since.
Can you tell me when in your career trajectory that you knew you were in love with public health?
Very early. And I think partly it was I had amazing mentors early in my career. So I was able to work with Rima Rudd, who's one of the foremost health literacy scholars. And if anybody could make you fall in love with public health, it would be Rima. And I think just so early on in graduate school, I worked with great people, had amazing mentors, and interesting projects from the real very beginning.
What makes communicating genetic and health risk information so challenging?
How long do we have? It's a sort of case study of everything that makes communication difficult. So that people have trouble with probability, it's complex concepts, but it's also emotionally laden information where it's relevant to people and their families. And so it's a perfect case study for how to communicate about difficult issues.
How can we make health communication more inclusive and accessible?
I mean, it has taken longer than I would have liked in the field of genetics, but I think actually working with people, so not just experts, but community advocates, people for whom this is most relevant, caregivers, and actually getting a sense of how they communicate and what makes sense to people.
Can you talk to students about why they should learn a little bit more about health communication?
Yes. I mean, why wouldn't you want to do this? This is the world's most fascinating topic. But I think no matter what you do in public health, you have to be able to communicate it to the public because if we can't communicate what we do, people don't value us. And I think it's just so essential. So whether you're a health communication researcher like me, of course, I love it. But I think all of us need to know, how do you communicate to the public? How do you communicate to funders? It's just a really central pillar of what we do in public health.
What have you learned from working with families on sharing genetic results?
So many things. I think it's that, the approaches that make sense to experts and people who know about genetics, they tend to start with like, here's the structure of DNA, here's what a gene looks like, here's the base pair switch. That is not what most people care about. They want to know, am I going to get this? Is my family going to get this? And what do I do about my cancer risk? And so it's entirely flipped the way I think about information. So we start with what used to be the punchline, what we lead up to, and change it so that the punchline is first and people care about it because they're engaged with it right away.
Well, Dr. Kaphingst, thank you for participating in discussions with the Dean at the 2025 American Public Health Association annual meeting.
Thank you.